My name is Gary Benedetti. I'm an orthopedic trauma surgeon at Panorama Summit Orthopedics. And on the side, I do total joint arthroplasty and some general orthopedics. I was an engineering student at the University of California, and I was planning on designing orthopedic implants. And all of my roommates were pre-med and all studying for the MCATs, and I was helping them study. And I said, well, this doesn't look that hard. So I took it and I did really well. So I went to medical school. And I went to the military medical school, and they don't need anyone to design implants. They needed people to take care of soldiers. Found that I really enjoyed fixing fractures. So I initially was an orthopedic trauma surgeon at Brooke Army Medical Center. The Air Force loaned me to the Army, and I taught residents. It was a level 1 trauma center for San Antonio. We did civilian trauma. And from there, I went to Wright-Patterson Air Force Base in Ohio. And there, that was an arthroplasty practice. It was a lot of retirees and not a lot of soldiers. And so that's where I really worked on my arthroplasty skills. And from there, I went to Alaska, and I was the chief of surgery, the surgery commander at the Air Force Hospital in Alaska. I took care of a lot of the Army soldiers that lived next door at Fort Richardson. There, I did a lot of sports medicine and fracture work. While I was in the military, I did a lot of traveling. I was on a forward surgical team, so we would 5 of us would operate out of our backpacks, and the idea was to bring the surgeons to where the soldiers were wounded versus the other way around. And I did 5 deployments to the Middle East. And then between those big deployments, I did lots of little missions with the surgical team, traveled all over the world. From there, I got out of the military and went to a private practice in Alaska, and I was really for a long time, the only orthopedic trauma surgeon in the state. And I was the first one to introduce the anterior approach total hip to Alaska. And that became very popular, and that sort of took over most of my practice when I was there. From there, I went to Wisconsin for a few years, and then this job opened up, and they wrote the job description for me, and so here I am. And so the opportunity to come back and work and live where we can play instead of traveling to play appealed to us greatly. Coming here, I first thought I'd be a little bored. It would be simple fractures, but it's not. It's very high energy injuries we're seeing off the ski hill. And then the volume, the numbers that you don't even see at a level 1 trauma center. And it's all high energy injuries. It's very little low energy fractures here, so it's sort of right up my alley. It's what I like to do. I've always been a guy who tried to do what the science said. A lot of our science isn't very strong. A lot of our literature is fragile. That being said, I try to pick out what's evidence-based, and if it's not evidence-based, then we go on experience-based. I try to teach my patients the options and try to educate them. Physician means teacher, and that's my primary job, is to teach you what's going on and what your options are. I think that surgery is a last resort for many problems, and I always try to get you better without surgery. I've been taking care of patients for almost 30 years, and so I'm very efficient, I think, and I kind of got a good feel for people and what they're looking for. But when I'm not working, I like to spend time with my family. My family is my wife and my dogs. We raise Leonbergers, which is a rare large breed dog, and they're very companion animals, and we spend a lot of time with them, and we walk with them and hike with them. We have a sled dog that we brought down from Alaska, and we ski jor behind her and take her hiking. If we're not doing chores around the house, we're always outside doing something. In the summertime, we hike and stand-up paddleboard and kayak and camp a little bit. When in the wintertime, we're either on the alpine skiing or cross-country skiing or snowshoeing and just getting outside. My wife is very hard to hold down inside the house, and if I can't find her, I know she's outside somewhere doing something. I met my wife in the Air Force. She's an orthopedic surgeon as well, and her passion is hand and upper extremity surgery. Although being in the military, she's a very good trauma surgeon, and she's a pretty good sports doctor as well.